Good afternoon. My name is Priscilla Batarse, and I'm presenting my systematic review on the effect of a gluten-free diet on reducing bloating in adults with irritable bowel syndrome. This research was conducted as part of the Applied Nutrition Capstone at the University of New England. Today, I'll walk you through the findings and their implications for clinical practice. However, for simplicity, moving forward, I may refer to a gluten-free diet as GFD and irritable bowel syndrome as IBS for the rest of the presentation. Let's move on to the introduction of this presentation. So let's define irritable bowel syndrome. So irritable bowel syndrome is a common functional gastrointestinal disorder that affects up to 40% of the global population. Defined by the Rome 4 criteria, IBS is characterized by symptoms such as bloating, abdominal discomfort, and altered bowel habits, all of which can significantly impact quality of life. IBS is classified into 4 subtypes. We have subtype, which is predominantly constipation. We have a subtype, which is predominantly diarrhea. We have a mixed subtype. This involves both constipation and diarrhea. We have the unsubtyped IBS. This is for cases that do not fit into any of these other categories. Dietary interventions, particular gluten-free diet, have gained attention as a potential strategy for managing IBS symptoms. This presentation focuses on exploring whether a gluten-free diet effectively reduces bloating, which is one of IBS's most troublesome symptoms. Let's now discuss the research objectives for this presentation. My primary goal of this review was to evaluate whether a gluten-free diet can reduce bloating in adults with IBS. It also examines individuals with specific markers, such as non-celiac gluten sensitivity and genetic traits linked to an increased risk of conditions like celiac disease or gluten sensitivity. By synthesizing evidence from recent studies, this work aims to provide insight into the effectiveness of a gluten-free diet as a targeted intervention for managing IBS symptoms. Let's move on to the methods of this research. This systematic review followed PRISMA guidelines to ensure a comprehensive and transparent selection process. A total of 15 randomized controlled trials published between 2011 and 2022 were included in this study. These studies focused on adults with IBS and compared the effects of gluten-free diets to other approaches, such as the low FODMAP or gluten-containing diets, over 2 to 12 weeks. From an initial set of 333 studies, only those meeting strict inclusion criteria were selected. Now we're going to dive into the search strategy. The study, which was a comprehensive search strategy guided by the PICO framework, which stands for Population, Intervention, Comparison, Outcome, and Timeframe, was used to ensure a focused approach. Major databases like PubMed, Cochrane, Scopus, Embase, and ScienceDirect was searched. To identify relevant studies, there was a combination of general and mesh terms such as gluten-free diet, IBS, gastrointestinal symptoms, non-celiac gluten sensitivity, and much more were used. This ensured the research captured a wide range of studies related to the topic. For the specifics of the inclusion criteria, the study selection was based on specific criteria. Only randomized controlled trials comparing a gluten-free diet to a gluten-containing diet were included, with participants being adults diagnosed with IBS. Studies involving individuals with celiac disease or gluten sensitivity unrelated to IBS were excluded to maintain focus on IBS and bloating. Additionally, studies that did not measure bloating as an outcome or were not published in English were excluded from the study. In this slide, I'm going to go over the exclusion criteria. The exclusion criteria included studies that did not compare a gluten-free diet to a gluten-containing diet. Studies involving participants under the age of 18 or studies focusing on individuals with celiac disease or other gluten sensitivity unrelated to IBS. Additionally, studies that did not measure bloating as an outcome, were not published in English, or involved non-human participants were further excluded to ensure relevance and focus on IBS. In this slide, I'm going to briefly touch on the outcome measured. So let's start with the primary outcome. This was the reduction in bloating severity in adults with IBS on a gluten-free diet compared to those on a gluten-containing diet, assessed using tools such as the Visual Analog Scale, the IBS Symptom Severity Score, and the patient-reported outcomes. As for the secondary outcomes included stool consistency, measured by the Bristol Stool Form Scale, gastrointestinal comfort and quality of life. These additional outcomes provide broader insight into the potential benefits of a gluten-free diet, though they were not required as primary endpoints for the study inclusion. For the statistical significance reporting of this study, the review considers results significant if the likelihood of the outcome being due to chance is less than 5%. For results that don't meet this threshold, the exact probability is provided to show how close or far it is from being significant. I'm going to move on to the results of this study. The initial search identified 333 studies, with 289 remaining after removing duplicates. After screening titles, abstracts, and full text articles, only 15 randomized controlled trials met the criteria. These trials evaluated outcomes like bloating severity, frequency, and quality of life. Most showed significant symptom reductions with a gluten-free diet compared to gluten-containing diets. Some patients experienced rapid relief within weeks, though results varied depending on populations and protocols. Strict adherence to the diet consistently led to better outcomes, while partial adherence was less effective. In this slide, we're going to go over some of the study's characteristics. The studies were conducted in diverse clinical settings across Iran, Italy, the UK, Sweden, India, and Australia, with sample sizes ranging from 20 to 180 participants and intervention durations of 2 to 12 weeks. Most trials compared gluten-free to gluten-containing diets, while some explored additional strategies like the low FODMAP and Mediterranean diets. All participants were aged 18 or older with non-celiac IBS and followed structured interventions designed to evaluate the effects of gluten on symptoms, specifically bloating in this research. The diversity in study designs and populations emphasizes the broad applicability of findings and the variability of individual responses. In this presentation slide, we're going to discuss the 3 studies showing the most significant improvement in bloating reduction. 13 out of the 15 studies showed some improvement in bloating. However, the 3 that demonstrated the most significant improvement are Picianto and colleagues, 2019, showing a p-value of 0.001, which is the highest significance. This diet found that a low FODMAP diet plus a gluten-free diet significantly reduced bloating symptoms. This research suggests a potential additive effect of combining low FODMAP and gluten-free approaches. In the second study showing the most significant improvement is Eli and colleagues, 2016, with a p-value of 0.001. They found that non-celiac gluten-sensitive participants, they experienced notable bloating relief on gluten-free diet versus a placebo. The study also emphasizes that gluten elimination can positively impact IBS symptoms even without celiac disease. In the third study, Padiano and colleagues, 2019, and pardon if I'm butchering some of these names, they showed a p-value of 0.01. In this study, research demonstrated that a gluten-free diet significantly reduced bloating, although other diets also provided benefits. This study also compared other diets like the Mediterranean and the low FODMAP diet, illustrating that a gluten-free diet isn't the only effective approach, but is highly beneficial. These findings suggest that a gluten-free diet can provide meaningful relief from bloating for IBS patients. This table summarizes a broader range of randomized controlled trials on the impact of a gluten-free diet on bloating in IBS patients. In addition to the 3 studies, most studies show some level of improvement in bloating, though the degree of statistical significance ranges from highly significant reductions to more moderate effects. Now I'm going to share some diet comparisons for IBS management. So let's start with the low FODMAP and gluten-free diets. These both reduce bloating significantly per the research. Highly restrictive, long-term endurance is challenging with these diets. Modified low FODMAP, including some gluten, does offer similar symptom relief with improved endurance. In regard to the Mediterranean diet, this diet is flexible and sustainable. It enhances quality of life. 86% of participants favored it for IBS management. The traditional dietary advice is more cost-effective and it fits daily routines. However, it is less effective in reducing bloating compared to restrictive diets. Now let's touch on some symptom relief insights. The low FODMAP and gluten-free diet does reduce bloating severity by 40% with a p-value of 0.01. This is demonstrated in some of the studies. Reduced gluten diets offer a compromise. They alleviate symptoms, improve satisfaction, and they also minimize social limitations. Personalization is essential. Diets like the Mediterranean or modified low FODMAP balance symptom relief and practicality. The gluten-free diet is best for patients with confirmed gluten sensitivity. Aligning dietary strategies and interventions with individual lifestyle for long-term success in managing IBS is important. Now we're going to move into the discussion of the systematic review and research. Gluten-free diets significantly reduce bloating in irritable bowel syndrome patients, especially those with non-celiac gluten sensitivity or genetic markers such as human leukocyte antigen. It is most effective for individuals genetically predisposed to gluten sensitivity, making it a targeted dietary option for these groups. Again, outcomes vary by IBS subtype, dietary triggers, and compliance levels. Strict gluten elimination is difficult to sustain. Personalized approaches such as reduced gluten diets or combined gluten-free and fermentable carbohydrate restrictions do improve follow-through and overall outcomes for patients with overlapping triggers. Responses are influenced by genetic predispositions, gut microbiota composition, and psychological factors such as stress and anxiety. As a result, personalized nutritional interventions are essential to address individual triggers rather than trying to apply a one-size-fits-all approach. That does not work. This will address each patient's specific triggers, genetics, and lifestyle necessary for achieving optimal outcomes and ensuring long-term success in managing their IBS symptoms, specifically bloating in this case. In conclusion, the gluten-free diet shows the potential to reduce bloating for specific IBS subgroups, particularly those with non-celiac gluten sensitivity or genetic predispositions. However, the variability in responses and the role of fermentable carbohydrates, commonly referred to as FODMAPs, really highlight the need for personalized, stepwise approaches to dietary interventions. Further research is essential to develop sustainable and effective strategies for managing IBS symptoms across diverse populations, specifically bloating. Thank you for your time. I appreciate your intention and engagement. If you have any questions or would like further discussion, feel free to ask now. Together, let's continue exploring personalized approaches to improve health and quality of life through nutrition. Thank you.